Hi, my name is Andrea Valencia. I am an acupuncturist and herbalist at Healing with Zen in Pasadena, California. And I wanted to share a case study of anxiety. So I have a patient who is a 28-year-old female who's been coming in since May for anxiety. Her anxiety is related to stress and oftentimes stress involving work. She is in the healthcare industry, and since the pandemic, things have escalated so much in regards to stress and practice management, which has been really affecting her anxiety. When I initially saw her in May, she was presenting with chest pain. So she would get shooting pain that would oftentimes start mid axillary line, right? So the side of her body, and it would shoot up above her chest and then towards her sternum. Her chest also felt very hard. She was oftentimes would find herself tapping her chest with her fingertips to somehow relieve some pressure. She was also getting migraines at least once a week, and the migraines would last anywhere from 2 to 4 days and would be almost debilitating, where she was having a hard time working. Typical migraine signs, as far as like light sensitivity, sound sensitivity, she would also start seeing halos. So it was making work and just daily life more unpleasant and difficult to navigate day to day. So on our second visit, we had a treatment plan. My treatment plan was to see her bi-weekly, so every 2 weeks, in order to also support her financial circumstances and to give her herbs and stretches, anything else to kind of take home as homework for her to work on during this time. So that first day when she had come back and we had talked about the plan, she had just experienced a headache. It was 4 days long, her usual wrapping around the head, a lot of pressure. We gave her treatment, and afterwards I had recommended doing pec stretches, so using the wall. I also recommended some yoga stretches as a yoga instructor that she could do to open her heart and relieve and stretch these tight muscles. When she had come back the following visit, so 2 weeks from then, she expressed not having been feeling any chest pain for 2 weeks. So this was a weekly occurrence. Now it was becoming a bi-weekly occurrence, which is great. And then since then, she hadn't had any migraines at all, which is amazing. She had been doing her homework, her stretches, breathing, and making sure she opened up her chest daily. 2 weeks after that, she had reported no chest pain for 2 weeks at all, no headache, and at this time it had been a month. So her chest pain was becoming bi-weekly, no headache for a month. The following visit, so this is now her fourth visit, there was no chest pain for a month, but her headache had come back. She'd had her headache, and it was only this time like one day, so it wasn't the 4 day span that she usually experiences, but the same presentation. She was also taking the herbs at this time. I forgot to add, as well as the pec stretches. So we gave her treatment to help with the after effects of a migraine that she was experiencing. And then 2 weeks after that, she had come in, no chest pain still, and at this time it had been 1.5 months of no chest pain and no headache for 2 weeks. We had talked about, revisiting if she should still come in bi-weekly, because she had been doing so well and she'd been consistent with her herbs and consistent with her homework. We had decided to just see each other once a month. So after a month of not seeing her, she comes back and reports still no chest pain, no headaches. At this point, this is her 7th visit, and as you can see, we're starting to now slowly back off with the number of treatments and the frequency of treatments, which is always the goal. Whether you're coming twice a week, 3 times a week, or once a week, the goal is always to start weaning you off, giving you the tools that you need, stretches, dietary recommendations, whatever it is, so that when you are doing the homework, when you are doing the herbs, now you start just coming once a month. And with the reevaluation and coming together, deciding to do once a month, now hopefully when I see her the next visit, and maybe 2 more times after that, just a solid 4 visits once a month of her reporting no chest pain, then we start to do every other month. And she can enjoy her pain-free life and also enjoy not having to need treatment constantly and feeling more empowered in the body. She knows how to take care of herself. She knows what herbs she needs. And now treatment becomes more of a support and a maintenance rather than treatment to help something that's more acute, more uncomfortable in the body. I'm so happy that she's feeling better and more supported, even though the stress of her work still hasn't changed. But her anxiousness has decreased significantly along with the chest pain, and she feels and reported that she's able to just kind of manage the stress a little more, which she is so happy and thankful for. So if you want to hear more case studies on body pain, mental health issues, sexual health issues, go to our YouTube channel, go to our website, or call if you have any questions. Our number is 626-377-9596.